Hello everyone. So today we are going to be talking about the trigeminal nerve. So let's understand the meaning of this word. Tri in Latin means three, whereas geminis means twins. So basically it's telling us that this particular nerve has three twins, or rather three branches. It was described by Fallopius and then again by Meckel in 1748. And the term trigeminal was coined by Winslow on account of its three divisions. Trigeminal nerve has four nuclei, three sensory and one motor nucleus. The three sensory nuclei include the mesencephalic nucleus, main sensory nucleus, and the spinal nucleus. In the midbrain, we have the mesencephalic nucleus. Afferent fibers to the mesencephalic nucleus convey kinesthetic sensations from teeth, oropharynx, jaws, from the stretch receptors in the masticatory muscles. So this nucleus is mainly concerned with proprioception. In the pons, we have the principal or the main sensory nucleus, and it responds to various tactile and pressure stimuli applied to skin, mucous membrane, palate, orbit, and teeth. The spinal nucleus is present in the medulla, and it is concerned with pain and temperature changes. It is cytoarchitecturally divided into pars oralis, which receives input from oral and nasal regions, and pars interpolaris and pars caudalis, which receive afferent from the cutaneous portion of the face. The motor nucleus is located in the pons medial to the principal nucleus, and it receives fibers from the mesencephalic nucleus along with the proprioceptive information to mediate the efferent portion of the jaw jerk reflex. So this is the motor root and this is the sensory root, which gives off three branches, V1, V2, V3. We will be discussing each of them subsequently. Now the trigeminal ganglion is like a crescent shaped, or it's a half moon shaped, or a kidney shaped. It is convex anterolaterally and continuous with the ophthalmic, maxillary and mandibular nerves, which are the branches of the trigeminal nerve. Whereas posteromedially it is concave and it is continuous with the sensory root. It is located in a depression on the anterior aspect of the petrous temporal bone. It is enclosed within a pouch like recess of dura mater known as the trigeminal cave. From the ganglion we have three branches, the ophthalmic branch, maxillary branch and the mandibular branch. The sensory branches of the trigeminal nerve, they course more superficially than the trunk of the facial nerve. So they are more readily subject to damage during surgical procedures. Ophthalmic nerve is the smallest division of the trigeminal nerve. It gives off three branches, the lacrimal, frontal and nasociliary. Now from the sensory nuclei, we have the three sensory branches, that is the ophthalmic nerve, maxillary nerve and the mandibular nerve. The ophthalmic nerve leaves the skull from the superior orbital fissure, whereas the maxillary nerve from the foramen rotundum. Mandibular nerve, along with a branch from the motor nucleus, it exits the foramen ovale. So let us first begin with the ophthalmic nerve. Ophthalmic nerve, as we said, is the smallest division of the trigeminal nerve. Now it begins from the anteromedial part of the trigeminal ganglion and then traverses along the lateral wall of the cavernous sinus between the third and the fourth cranial nerves, and then exits the skull from the superior orbital fissure and comes onto the orbit. Before it enters the orbit, it gives off three branches: frontal nerve, nasociliary nerve and the lacrimal nerve. The frontal nerve is the largest branch of the ophthalmic nerve and it is divided into supraorbital nerve and the supratrochlear nerve. Supraorbital nerve supplies the skin of the upper eyelid, conjunctiva, forehead and the anterior scalp region, whereas supratrochlear nerve is the smallest branch and it supplies the fascia of the upper eyelid and the lower medial part of the forehead. The nasociliary nerve is divided into ciliary ganglion, short ciliary nerves, long ciliary nerves, posterior ethmoidal nerve, anterior ethmoidal nerve and the infratrochlear nerve. The long ciliary nerves supply the iris and the cornea. Posterior ethmoidal nerve supplies the sphenoidal and the ethmoidal sinuses. Anterior ethmoidal supplies the anterior ethmoidal frontal sinus, medial and the lateral nasal wall and tip of the nose, whereas the infratrochlear nerve supplies the conjunctiva and the lacrimal sac. The lacrimal nerve supplies the lacrimal gland and the conjunctiva, and it also communicates with the zygomatic branch of the maxillary nerve. Maxillary nerve, or the second division of the trigeminal nerve, is a purely sensory nerve. Its function is the transmission of sensory fibers from maxillary teeth, skin between the palpebral fissures, mouth, nasal cavity and the sinuses. It leaves the skull through the foramen rotundum, crosses the pterygopalatine fossa and gives off posterior superior alveolar and the zygomatic nerve branches. It enters the orbit through the inferior orbital fissure, traverses the inferior orbital groove and canal and appears on the face through the infraorbital foramen. In the cranium, it gives off a meningeal branch. This middle meningeal nerve supplies the dura mater. Now, in the pterygopalatine fossa, we have first the zygomatic nerve, which communicates with the lacrimal branch of the ophthalmic nerve. Now, this zygomatic nerve is divided further into zygomaticofacial and zygomaticotemporal. Zygomaticofacial supplies the skin of the face and the cheek, whereas zygomaticotemporal supplies the skin on the side of the forehead. In the pterygopalatine fossa, we have the orbital branches, which supplies the periosteum of the orbit, the nasal branches, that is the lateral nasal, which supplies superior and middle concave, and the nasopalatine nerves, which we will be seeing in the next slide. Then we have the palatine branches, that is the greater and the lesser palatine. Greater palatine nerves supply the hard palate, lateral wall of the nose. Lesser palatine supplies the mucous membrane of the soft palate and the tonsil, and we have pharyngeal nerves, and there is also the posterior superior alveolar nerve, which supplies the buccal region of the maxillary molar, adjacent facial mucosa, maxillary sinus, the periodontal ligament, pulpal tissues of the maxillary third, second and first molar, except the mesiobuccal root of the maxillary first molar. In the infraorbital canal, we have middle superior alveolar nerve and the anterior superior alveolar nerve. The middle superior alveolar branch supplies the second premolar and the mesiobuccal root of the first molar, along with the periodontal hard and soft tissues, that is the bone in the premolar area. An anterior superior alveolar nerve is a large nerve and it provides pulpal innervation to the incisors and canines. It is sensory to the periodontal tissues, buccal bone and mucous membrane around these teeth. On the face, we have the inferior palpebral, which supplies the skin of the lower eyelid, external nasal, which supplies the lateral aspect of the nose, and superior labial, which supplies the skin and mucous membrane of the upper lip. On the palatal aspect, we have the palatine nerves. First is the nasopalatine nerve, which is the largest and descends up to the anterior part of the hard palate through the incisive foramen. And we have greater palatine nerve, which supplies the hard palate and the lateral wall of the nose, and posterior palatine or the lesser palatine that supply the mucous membrane of the soft palate and the tonsils. So let's just brush up the branches of the maxillary division. So within the cranium, we have the middle cranial nerve. Within the pterygopalatine fossa, there is a zygomatic nerve, pterygopalatine nerve and the posterior superior alveolar. Zygomatic nerve further divided into zygomaticotemporal, zygomaticofacial. Zygomatic nerve, what does it do? It communicates with the lacrimal branch of the ophthalmic nerve. Then in the pterygopalatine nerves, we have further 4 branches, that is the orbital branch, nasal branch, which is further divided into lateral nasal, nasopalatine, palatine branches, that is greater palatine, middle palatine, posterior palatine and the pharyngeal branch. In the infraorbital canal, we have the middle superior alveolar and anterior superior alveolar nerves, and on the face we have the inferior palpebral, external nasal and the superior labial nerve. You see this collection of fibers at the apex of the teeth, that is the alveolar plexus. So basically it's just a terminal network of large nerves. The superior dental plexus, it contains small nerve fibers from the posterior superior alveolar, middle superior alveolar and the anterior superior alveolar nerves. Now these branches are further divided as the dental branch, which supplies the pulp, the interdental or the perforating branches that supplies the PDL of the adjacent teeth through the alveolar bone, interdental papilla and the buccal gingiva, and we have the interradicular branches that supplies the PDL of the adjacent teeth and terminate at the furcations. So now we discuss the mandibular nerve, that or the final branch, the third branch of the trigeminal nerve. In the middle cranial fossa, the sensory root and the motor root, as you see here, they exit the foramen ovale together, separately but together. And just below the exit of the foramen ovale, they will fuse together to form the main trunk. And then again they divide to form the anterior trunk and the posterior trunk. All this occurs in the infratemporal fossa. The main trunk further divides to give off two branches, that is the meningeal branch and the medial pterygoid branch. The anterior trunk, it divides to form the buccal nerve, masseteric nerve, deep temporal nerve and the lateral pterygoid. It supplies the muscles of mastication. Posterior trunk further divides to form the auriculotemporal, lingual and the inferior alveolar nerve. This is a summary of all the branches of the mandibular nerve. We will be discussing each of them individually now. So as we saw, from the main trunk we have the meningeal branch or the nervus spinosus. It enters the skull through the foramen spinosum, spinosus spinosum, along with the middle meningeal artery and supplies the dura and the mastoid cells. And then we have the nerve to the internal pterygoid or the nerve to the medial pterygoid. It is motor and it supplies the internal pterygoid, tensivelli palatini and tensor tympani. From the anterior trunk, we have motor branches as well as sensory branches. The motor branches include the masseteric nerve, deep temporal nerve and the nerve to lateral pterygoid. These supply the respective muscles of mastication. It also has a sensory branch, that is the buccal nerve or the long buccal nerve. This is the only sensory branch of this division and it supplies the skin of the cheek, retromolar triangle, buccal gingiva of lower molars and the mucobuccal fold. From the posterior trunk, we have the auriculotemporal nerve, lingual nerve and the inferior alveolar nerve. So this is the auriculotemporal nerve, which is formed by two roots which encircle the middle meningeal artery and it unites to form a single trunk. The auriculotemporal nerve has 5 branches. So we first have the parotid branch, which supplies the parotid gland. Then there is the meatal branch that supplies the skin lining the meatus and the tympanic membrane. The anterior auricular branch that supplies the skin of the helix and the tragus. Superficial temporal branch that supplies the skin over the temporal region. And then lastly it has an articular branch which supplies the posterior temporomandibular joint. The lingual nerve is joined by chora tympani nerve around 2 cm below the skull. It is present medial to the third molar. It enters the surface of the hyoglossus and the genioglossus muscles to reach the tongue. It is sensory to the anterior 2/3 of the tongue, mucous membrane of the floor of the mouth, gingiva, on the lingual aspect of the mandible. The inferior alveolar nerve is present medial to the lateral pterygoid in between this sphenomandibular ligament and the lateral surface of the ramus. It enters the mandibular foramen accompanied by inferior alveolar artery and inferior alveolar vein. The artery lies anterior to the vein. Before entering the mandibular foramen, it gives off a mylohyoid branch. Now this mylohyoid nerve is motor to the mylohyoid muscle and anterior belly of digastric and sensory to the mandibular incisors and skin on the anterior and inferior surface of mental protuberance. At the mental foramen, it divides further into 2 branches, the mental nerve and the incisive nerve. The mental nerve supplies the skin of the chin and the skin and the mucous membrane of the lower lip, whereas the incisive nerve supplies the labial aspect of the gums on the incisors and the canines. These are my references. Hope you enjoyed it. Any suggestions are most welcome. Thank you guys. See you soon.